Good morning. Today is January the 4th. It's Friday. I'm heading to work, leaving a rheumatology appointment. I went in for the swelling in my hives. They're still there. My face is still swollen. It's been this way for 8 weeks and no one can tell me why. So that's a little frustrating. I did do my first immunotherapy treatment last week. It was not what I expected. It wasn't bad. They told me you normally don't have side effects from it. It's the Keytruda. They said normally you just look out for the rash possibly, or some nausea, vomiting. I didn't get the nausea, vomiting, but that evening I was covered in a rash on top of the rash that I already have on my face and the swelling. And I got a little bit of the joint pain, but that was about it. So I am starting my Taxol next week. I'm excited, getting ready to get started. To count down for that, I have 20 weeks of infusions. So still hopeful. Not looking forward to the lethargic part or the nausea, vomiting, but ready to actually get started with treatment. This week I've been out of work some of the days because my eyes were swollen shut. So that's a little frustrating, especially when no one can tell me what's going on with that. I did go get a biopsy on my chest for this rash. And that was negative. Thank the Lord. So it's not been a bad week. Next week I have to repeat the biopsy in my axilla and in my breast as a part of the trial that I'm doing with immunotherapy. And that's Wednesday, and then chemo is Thursday. I'm getting used to the cut. It's a little sassy. That's about it. I don't really have anything else. So I did go to therapy yesterday. It was the first time I met with the therapist for oncology, and it wasn't really a therapy session, which was good. She was giving me some things to think about because I'm struggling with the decision of whether I should do a lumpectomy versus the mastectomy. I'm in a lot of the support groups on Facebook and just reading their stories, like I'm a second-time cancer survivor or a third-time cancer survivor, or things of that nature. Trying to figure out what's the best decision for me to try to make sure I can do what I can do on my part for it not to reoccur. I mean, I know that with some it's inevitable. The surgeon did say that regardless if I did the lumpectomy or the mastectomy, the reoccurrence wouldn't change. So just trying to wrap my mind around, if I do a lumpectomy, do I have to be on alert and worried all the time, or fearful that it will reoccur? Because I want to do this one time, ring the bell, and go about my business. I am counting down to ringing the bell. I'm so excited about that. I have to speak it into existence. I have to be positive. I have to know that this is going to happen. I have to manifest this. Not for just me, my mom, my sister, my husband, my kids. I have to live. I have to choose to live and not die. I had someone ask me, Chantel, so did they say if you're going to live? The doctors are doctors. They are medical professionals, as myself as a nurse. But we don't have the insight. And I feel like God is just using me as a vessel to, to have a testimony to continue to motivate others. I'm shockingly being very positive through this. But I know that is the works of prayer and people praying for me and my circle and my village. I've had an enormous outpour of love and support through this so far. So I feel like that has helped motivate me as well. So just going to continue to stay positive, get through this so I can tell my story and continue to help others. That's what our purpose here on earth is for. Like, you go through lessons and seasons to have testimonies, to survive, to be able to help other people through life challenges. So that is it. That's me checking in for today. Love you all. I will keep trying to keep you posted on this journey. Happy Friday.